We will continue today with Freud's three more papers and then take a detour into my own book, Effective Psychoanalysis. And from there, we will finish the psychosexual stages and Freudian explanation of common pathologies. And then, if we have time, we will come back again to reading Freud in the original. So today we'll look at three papers: Obsessions and Phobias, Sexuality in the Etiology of Neurosis, and three essays on sexuality. These three papers are very important papers of Freud. It takes quite a long time to read each of them, which I would prefer each of you does. I am planning a separate course, Readings in Psychoanalysis, in which reading in original line by line and its discussion can be done, but it requires far more time than we have in this course. So I've decided to do a change in the pedagogy, and the pedagogy now would be geared to a faster coverage of the course. So today we'll take a look at a summary of three papers of Freud instead of reading them word by word like we did in preliminary communication. Let us start with the first paper for today, Obsessions and Phobias. Remember, Freud was starting off with discovery of these problems. So he was not as clear as we are today, obviously because he was discovering them for the first time. And he uses the word obsessions, while today we use the word obsessions and compulsions. He is trying very hard in this paper to separate obsession and phobia, which today are very clearly separate in our minds as we look at them. However, we are standing on his shoulders, and clarity of today has emerged only after years of work, which was founded on Freud's discovery. So let us look at what Freud has to say in the paper Obsessions and Phobias. I have done a short summary. I would recommend everyone to read the paper for oneself line by line. Obsessions and Phobias. Freud starts the paper by first trying to differentiate between the three terms: neurasthenia, obsessions, and phobias. Neurasthenia is what is characterized by lassitude, fatigue, irritation. In today's language, we would call it mild depression. So first, Freud starts the paper and tries to clearly separate neurasthenia from obsessions and phobias. And today it's quite clear that the two are separate. Obsessions and phobias are anxiety spectrum disorders, while neurasthenia or depression is a mood spectrum disorder. In early days, it was very difficult to separate because everything was just entangled together. And we were not clear, rather Freud was not clear how to exactly list out characteristics of each pathology. He does the hard work of separating neurasthenia from obsessions and phobias. So the first part of the paper deals with separation, that neurasthenia is very separate, very different from obsessions and phobias. Then he tries to separate obsessions and phobias from ordinary hysterical problems. So he tries to see how the traumatic recollection through a symptom of ordinary hysteria is different from obsessions and phobias. So he's trying very hard to clearly establish obsessions and phobias as very distinct psychopathological problems. So first he differentiates obsessions and phobias from neurasthenia or depression. And then he says obsessions and phobias are not only separate from depression and very distinct into themselves, but they are also very different from ordinary hysterical symptoms. So this is a special class of problems that we are looking at. The problem of obsession and the problem of phobia. And then Freud tries to delineate or separate obsessions from phobias. So slowly he is arriving at very precise, specific, crystal clarity. First, he says neurasthenia is different from obsessions and phobias, so that is kept aside. Then he says hysteria ordinarily understood is different from obsessions and phobias, that is kept aside. And now he's trying to very clearly delineate obsessions from phobias. And he says in his paper, obsessions have a quality of intrusion and an associated affect. So there are two distinct characteristics of obsessions in his view. The first characteristic is the characteristic of intrusion, that there is an intruding thought. Something against the will, unwanted by the will, is making its appearance in the mind even if we don't want it. There is an intrusive thought that comes in. And along with that intrusive thought, which comes despite our will, and the coming of that thought is repetitive, there is a repeated intrusion into our minds despite our will. There is also an associated affect with that intrusion. That affect can be anything. It may be anxiety, remorse, guilt, shame, but there is some affect along with that intrusive thought. So Freud says obsessions have this quality that there is an intrusive thought and an associated affect. So we are looking at a thought and an affect. And the affect can be anything. It can be anxiety, remorse, guilt, or shame. This is how Freud thought about it in his paper. Very early, we are talking about 100 or more years before. Today, we understand it far more clearly, and our understanding is different. We'll take a look at it in the next slide. But for the moment, as Freud said it. Phobias, Freud says, are different. He says, phobias have two distinct qualities compared to obsessions. First, they don't have the characteristic of an intrusive thought. Only when the object of phobia makes its appearance, that the phobia starts. By itself, phobia does not have the characteristic of spontaneously intrusive and repeating thoughts. That a characteristic which obsessions have. And secondly, the associated affect in case of phobia is always anxiety. And the occurrence happens in the presence of the phobic object, the object of phobia. So the difference between obsession and phobia, Freud says, is in phobias we don't have a spontaneously repeating intrusive thought. 2, the associated affect is always anxiety, unlike in obsession where the associated affect can be anything. It can be anxiety, remorse, guilt or shame. In phobia it always has to be anxiety. And 3, the occurrence of phobia happens in the presence of the object, whereas in case of obsession it can just go on spontaneously without any external trigger. So that is how obsessions are different from phobias. Then he talks about the dynamism in obsessions and the dynamism in phobia. He says it may happen in therapy that a person comes with a particular obsession, works in therapy, and the obsession goes away, the person gets relief, but after some time another obsession starts. Or the person has an obsession of something for a few days, after some time that obsession goes away and is replaced by another obsession. So Freud says the specific obsession may vary and yet the emotional state may still remain the same. For example, if somebody has an obsession of washing hands and feeling guilty, the obsession of washing hands may go away, but the emotion of guilt may continue, and after some time another obsession may develop, even though the effect of guilt continues to be constant. So there can be affect constancy even as the intrusive thought changes from one to another. For phobias, Freud also talks about the dynamism, that there is dynamism in phobias also. It is not the case that if you have a phobia of going out of your house, it will always remain this for entire life. There is dynamism in phobias also. What you have phobia for today, you may not have phobia for 2 years from now, and then there may be a lull period and again a new phobia may develop. Or you have phobia for water and then you may develop an additional phobia for fire. So there is dynamism in phobias that also Freud mentions. But in phobia, unlike in case of obsession, the associated affect always is constant, which is anxiety. In obsessions, Freud says the way obsession starts is there is some traumatic event, and the original traumatic idea which occurred during the traumatic event in the unconscious mind is replaced. So if there was fear of committing a sexual transgression, it is replaced by some fear of committing some other transgression. The original idea gets replaced, and therefore this replacement keeps creating a series of changing obsessions where the underlying traumatic event and the original idea and the original affect remains the same. In phobias, fear is transferred onto an innocent object, which then becomes the object of fear. So similarly, in case of phobia, there is a traumatic event. Fear, anxiety is generated in that traumatic event, and that anxiety is transferred onto an innocent object, because of which an innocent object becomes an object of fear. So the unconscious mechanism in both the cases is the same. There is a traumatic event. During the traumatic event, there is an idea and there is an affect. The affect gets transferred in case of phobia onto an innocent object, and therefore an innocent object appears like an object of phobia, an object of fear. In obsession, the original idea of the traumatic event is displaced by some other idea, and the original affect by and large continues. So this is how both of them, in their origin, in their pathogenesis, are similar to hysteria and all psychopathology, which is, in all psychopathology according to Freud, there is an original traumatic event. The traumatic event usually is in the childhood, and in that traumatic event there are thoughts and there are affects involved, and these thoughts and affects are in the unconscious mind, and in some peculiar way these thoughts and affects create our symptoms. And when in therapy these thoughts are made conscious and integrated with the conscious mind, and the affect is fully felt and relieved in the process of catharsis, the healing happens. Freud then goes into 10 examples. I have taken 5 in the slide. You can read other 5 in the paper. Freud takes 10 cases of different types of obsessions. First, case 1. A person had an obsessive thought that he had stolen money and he was printing counterfeit money, when in fact he knew none of this was true. So even as he had a clear insight that this was not true, these intrusive thoughts could not be stopped. Repeatedly, these intrusive thoughts would keep coming to him that he had stolen money and he was printing counterfeit money. And upon analysis, upon therapy, Freud found that once upon a time, the traumatic event involved intense urge of masturbation, which the person controlled, and then it probably indulged in for some relief. And that guilt of having done something wrong came up in the form of this repeated intrusive thoughts. We won't go into the details of the cases as to why, what does the stolen money signify, why counterfeit money, what are the unconscious meanings of this. That will be quite a large case to study, but those who are interested can go into it. But I would only put the point that in the unconscious mind there was a traumatic event involving masturbatory desire, control of it, indulgence in it, and having relief, and then the emergence of intrusive thought of stolen money and counterfeit money. Case 2, Freud cites of a medical student who had intrusive thoughts that he had killed his cousin, he had committed immoral acts, including incest with the sister, and he had set fire to the house. And he had very clear insight that none of it was true. Obviously, because the cousin was alive, everyone and he himself knew he had not committed any immoral act, and the house was still safe. Despite evidence in reality the obsessive thought would not go away. And this, Freud says, upon analysis was found he was addicted to masturbation, and he read somewhere that it depleted morale. And from there something happened and he started having these intrusive thoughts. And in all these cases, when the unconscious was made conscious and the feeling was felt and allowed to let go, the person started having relief. Freud says a very common obsession in his time used to be, women used to have this obsessive intrusive thought that they will decide to throw themselves out of the window, that they will stab their children with knives or scissors. And most of them, in the unconscious mind, the situation was they were not satisfied in marriage. Adulterous ideas at the sight of other men led to this anger towards the self out of guilt, and then the obsessive thoughts deflected onto others. So the obsessive thought was throw oneself out of the window, stab the children with knives and scissors. And the unconscious cause of that was dissatisfaction in marriage, adulterous ideas and feelings at the sight of other men. Case 4, disgust and hatred for servants. This became an obsessive thought for somebody. And the traumatic event was that person had seen the mother in an adulterous relationship. And therefore, the disgust at the mother became disgust at all mother figures, and this included female servants. Obsessive urination and complete isolation. So a person had obsessive traits related to urination and isolation. And he had seen a man in theater discharging and urinating, and thereafter developed disgust and had this obsessive intruding ideas and feelings. So Freud cites these 10 cases where the obsession is X and the cause is Y, and Y is an unconscious event, some traumatic event in the past, which has an idea and an affect. And the symptom is a way in which the traumatic event communicates itself to us and pathologically acts itself out. There are 5 more cases if you wish to go into details of. Today we understand this in a very different way. Today we are very clear about 2 things, obsessions and compulsions being different. When we refer to obsessions, we refer to obsession of thought, and when we refer to compulsion, we refer to repetition of any action. So intrusive, out of control repetition of thoughts we call obsessions. Out of control repetition of actions we call compulsions. And if both are present, we say obsessions and compulsions. Today we say these obsessions and compulsions both are ways of channelizing and binding anxiety. So the core problem is anxiety. The question then is, what is generating this anxiety? And this has different answers in different schools, and probably different answers are true for different cases. Freud would say the anxiety being generated is because of the Oedipus complex. Klein would say anxiety being generated is because of the split being open. Kohut would say anxiety is being generated because of an unhealthy self. Winnicott would say anxiety is being generated because of not having a good enough mother in the early childhood. Jung would probably say anxiety is being generated because the predator archetype is overactivated, while the hero archetype or the paternal protector savior archetype is underactivated. So different schools will give different explanations. ISTDP might say it is the murderous and the torturous rage whose coming up is creating this signal anxiety, which is then being channelized into the obsession or compulsion, or both. So the cause of anxiety is differently understood and believed in by different schools of psychoanalysis. However, all schools by and large agree that obsessions and compulsions are ways to channelize and bind anxiety. So today we look at both obsessions and phobias as anxiety spectrum disorders. In both cases, there is displacement of anxiety from the traumatic event onto something. In obsession, the anxiety generated out of the traumatic event, be it the Oedipus, be it the split, be it the unhealthy self, or any other reason. Whatever be the cause of anxiety, the anxiety generated is channelized into obsessions and compulsions. And this is one of the reasons why, if you don't allow the person with obsessions and compulsions to act out the obsessions and compulsions, or sort of indulge in obsessions and compulsions by any means that you have, suddenly there is a mounting rise in anxiety, because the anxiety which was getting channelized through obsessions and compulsions now has nowhere to go, and suddenly there is a mounting of anxiety. In phobia also, mechanism is similar. There is a traumatic event which is generating anxiety, which can be Oedipus or split or anything of that type, and that is displaced onto an innocent object, which then appears as an object of phobia, an object of fear. So today we understand both as anxiety spectrum disorders. And in both cases, there is generation of anxiety, some source of anxiety, and a unique way of displacement of anxiety. So this is about obsessions and compulsions, the paper. You can read it in complete details. Let me know if you have some difficulty. You can also refer to my book, FAQ Psychoanalysis, in which I have given a small explanation of obsessions and compulsions. Today, people also believe that there is a strong biochemical base to the causation of obsession and compulsion, and it's not completely psychological. Therapists who work with obsessions and compulsions also have realized that in general, we see an obstinacy and a very harsh superego in case of patients with obsessions and compulsions. And in case of patients with phobia, we see very intense catastrophic thinking. Those of you interested in details of how catastrophic thinking works step by step, it is a 7-step phenomenon. You can see my video on my channel on catastrophic thinking, which details out 7 steps of the catastrophic thinking process. Any other questions? Send it to me at hvindia@gmail.com. Thank you.